Hi, I'm Dr. Mandell. Today we're going to show you how to help correct those lower neck pinch nerves that are coming out of that neck, going into the shoulder, into the arm, in the shoulder blades, that's causing you pain, numbness, cramping, tingling, difficulty sleeping, difficulty using your arms. Let's get to it and let's help these problems go away. But first, I want to explain some important things about your discs, about the neck, about the spine, and about the nerves, so you'll have a better understanding on how we can combat these problems. When we look at the spine and the neck from the side view, you can see that the curve of the neck, the same way I'm standing, is the way the spine is facing, that the curve in your neck has a C-shaped curve going inwards like this. When we bend the head forward, what happens is the disc pressure goes backwards. When we bring our spine the other way, the disc pressure then goes forward. Understand that the nerves that come out of the neck area come out in the back or posterior part of the neck region. When you look at this model here, this model will show you two vertebrae, a disc, and show you a pair of nerves. It shows you that the back part of this vertebrae is where the disc can actually bulge and herniate and cause pressure on that nerve, blocking off that energy. Just realize that the majority of time that you place your head in is in a forward position. That's where you're looking down at the computer, driving your vehicle, reading, writing, whatever you're doing. You need to get out of the habit of getting away from this forward postural position. Important, you must get your ears over and aligned over your shoulders to make sure you got that proper alignment. When you're looking down, get to the habit of jutting the chin downwards. But again, the alignment is intact, keeping the head from flexing forward. When you flex forward, imagine here's a vertebrae and here's a vertebrae. Between is a disc. We'll kind of look at that as a balloon. So when we flex forward, okay, you can see how it closes in the front and opens the back. That's where the bulging or the herniation comes backwards. When we flex upwards or an extension, you can see we close the back and the pressure goes forward. So when you're spending a lot of your time in this position, you're closing the front, pushing the pressure backwards, and having more of a tendency to irritate and aggravate those nerves that's coming out in the back part of the neck area. Millions of people in our world have herniated discs, bulging discs, osteoarthritis, degeneration. They can be helped naturally by doing the right exercises, doing and having the right posture, and being very aware and in tune with your body. From the side, remember, ears line up with the shoulders. Tuck the chin in. Don't look forward prolonged periods of time. When you're driving or using your arms, get them down. Don't keep them elevated so much or so long because it will kick in the upper trap muscles. These muscles here attach to the back of the vertebrae, causing more pulling, more tension, more irritation on the nerve. The muscles between the shoulder blades, called the rhomboids, those muscles must be strong, and the majority of us have very weak rhomboid muscles. So when we just pinch our shoulder blades back and release it, and pinch them back, pinch them together and release it, pinch them back and release them. Start using those muscles. Do those 12-15% 2 or 3 times every other day. The muscles in the front of the shoulders get inside the door, and you can put your arms inside the doorway and hold on and lean forward to stretch those muscles in the chest, because these muscles are contracted, they're tight because we're always pushing or pulling. we have imbalance going on between the front and the back. You must have balance, or the body will then continue to break down and degenerate. Make sure that the muscles of your neck are staying loose, because these are the things that turn and twist and allow us to move. And if those muscles are contracted and they're shortened, they're going to irritate nerves. So let's take the side of the head and gently pull it over. Gentle, not to where it hurts, to stretch the muscles. You can hold that 15 seconds. You can come to the other side and do the same thing, 15 seconds. You can pull back and pull forward to stretch the back muscles of the neck. And you can do the other side as well. Be creative. Stretch the muscles, change positions. Don't allow those muscles to stay in one position for long periods of time. That's when they fatigue, and that's when we start looking for problems. Most herniated discs, most bulging discs, and most of the pinched nerves that take place in the neck take place in the lower part of the neck, at the C5, C6, C6, C7 levels. So here's an excellent stretch for you to do. Take your two hands. I'd like you to put it behind your head, clasp your fingers together. And as you lean to the right side, take this left elbow and face it as high as you can towards the sky. And you're going to hold that stretch for 15-20 seconds. Come back, and you can do it again. And hold that stretch. Point that elbow towards the sky. Do that 5 times. But also, make sure you do the other side as well. As you grab behind the head, you'll take this elbow, and as you turn, as you twist to this side, you're going to point this elbow high as you can to the ceiling and hold it there 15 seconds or so. Come back to neutral and do that 5 or so times. That will help stretch the muscles in the lower neck and in the upper back. Most of you who have pinched nerves will feel this discomfort into the shoulder blade, inside that mid-back area, because those nerves go to the interscapular muscle. Those nerves that are coming off that lower part of the neck control inside the shoulder blade. That's why you're getting that burning, that cramping, that aching sensation. They go inside the deltoids, into the shoulders. Aching, tiredness, difficulty maybe holding objects up. They go inside the arm all the way down to the fingers, numbness, maybe difficulty holding a pen or grasping something. Everything feels weak. Those nerves play a lot of games. The nerves affect the muscles behind the skull. That's why you may be experiencing headaches. But if you notice that you can't turn your neck when you're driving and you're turning your whole upper body, even though you may not be experiencing a lot of pain, but the muscles are shortened, that's when you need to get on it early. Don't let these problems blow up, because it's much harder to correct things later than to prevent them earlier from occurring. Everything that we do generally is in front of us. Looking down, reaching forward, utilizing the muscles up in here. Those muscles are strong. They're going to pull our shoulders forward, called pronation. Women who have breasts, just the weight of the breasts, pull the shoulders forward. When the shoulders go forward, the head goes with it. If you leave the head forward for long periods of time, the body will go through deformation. It will start to change. It will start to compensate. It will start to go forward as well. And at that time, it's something that you have to learn to live with. So prevention. Prevention is the key. For these tight muscles, take your hands, clasp them behind your back. I want you to push your hands down to the floor and lift your chest up and feel those muscles of the chest stretch. Put your hands together, push them down to the floor, extending your arms, lifting your chest up, lifting your head up, and feel those muscles of the chest stretch. These muscles are always going to be contracted when we're looking down and looking forward. So stretch those muscles. You'll feel so much better. So with these muscles that are going forward, all contributing to your neck pain, let's take your arms by your side. Straight out, and let's go backwards, utilizing the rhomboid muscles, opening up the chest. utilizing the back muscles of the shoulders. And you're going to actually come backwards and continue to go backwards and do that for a minute or 2 minutes. But do that every day. Utilizing those muscles behind us will help balance out those contracted, tight muscles in our anterior or forward part of our body. I highly stress to you that if you are suffering from these chronic problems of nerve irritation, pain, discomfort, you need to look at your occupation. Look at the work that you do every day. If it's sitting and driving for long periods of time, if it's looking down at a desk, if it's holding the phone, whatever you're doing chronically, day after day after day, your body is talking to you. It's trying to communicate with you. It's trying to tell you to slow down, stop, change positions, do something different. You're overutilizing me. You're hurting me. Listen to your body. God has given you 2 ears and 1 mouth, meaning listen more than you should be talking. So, make sure you change positions frequently. Give those muscles a rest, and you'll be on your way to a speedy recovery. Make it a great day. I'm Dr. Alan Mandell.